Welcome to Cbido report as narrated. Through home visits, community health workers and caregiver in collaboration with Cbido professionals supported a child with disability performing physical therapy exercise. His joint effort aims to improve the child's mobility, strength, and overall physical development, while also empowering the family with knowledge and skill. Experts from Cbido conducted a capacity building session for caregivers and the community health workers on rehabilitation services for children with disability. This initiative aims to strengthen community-based rehabilitation, improve the quality of care provided. A youngster who received entrepreneurship training and the startup capitals has successfully started goat farming at his home. The initiative demonstrates the impact of skills training and economic empowering in enabling youngsters to become. A Cbido officer conducted a parenting education session for mothers focusing on positive parenting practice and child care. The training aimed to equip mothers with knowledge and skills to better support the physical, emotional, and social development of their children. Cbido conducted orientation and a training session for newly recruited 5 community-based rehabilitation coordinators so as to capacitate them on necessary knowledge and skills on disability inclusion, rehabilitation process, community engagement. As you can see, they are trying to demonstrate different approaches so as to equip the newly recruited staff with new approach and the guidance so that they can continue working without either in collaboration with the steering committee in the Miseni district, with parents and the caregivers of children with disabilities. We commemorated the World Down Syndrome Day at Kiaka. A mental health specialist from the DMO's office at Miseni district provided mental health education to the community. Members who attended explained the causes and the common signs of Down syndrome and highlighted that some children may experience epilepsy which can persist into adulthood, and emphasized that the importance of early care, support, and medical to avoid the large number of children who are affected with this disease to our community. Either a nutrition officer from the DMO's office also reminded the community about the importance of nutrition and balanced diet, and she emphasized the key food groups that make up a complete meal, encouraging families and the caregivers to ensure children receive adequate and nutritious food for health, growth, and development of a child. Ms. Grace Matafari, a police inspector working at gender desk at Kiaka Police Station, argued the community not to remain silent about gender-based violence, especially against children, and emphasized that even if the one who caused it is a family member, they have to report. A social worker from ELCT Kiaka shared a testimony on how 3 children from ELCT Kiaka Children and Youth Center were supported through the Pamoja project at the Cbido offices. The children received the medical assessment and the treatment, and this demonstrating the positive impact of collaborative effort in improving the health and well-being of child and with disability. A program officer from Cbido explained about the disability centers and the services they provide, highlighting the important role these centers play in supporting children and young people with disabilities through skills development, care, and empowerment activities. She further emphasized the importance of community bringing girls with disabilities to these centers to access opportunity for learning and personal development. A child from Kiaka with Mongolia disability, enjoying being involved and participating in Down Syndrome Day as asked by Master of Ceremony, and this is science. Cbido Executive Director also reminded the counselors of the importance of not stigmatizing children with disability and argued them to discourage inappropriate names. Either argued them to take care of these children as they take care of theirs to avoid stigma in the community. The council chairperson provided a clarification on funds allocated to support a project for children with disability, emphasizing the government commitment to strengthening inclusion. A Lugu ward representative expressed gratitude to the Pamoja project for supporting a girl with a disability by providing her with a sewing machine and a wheelchair. He appreciated the intervention, noting that it has greatly improved the girl mobility, independence, and ability to engage in productive activities. Also, representative commended the project of its continued commitment to empowering persons with disability and promoting inclusive development in a community. Mr. James Mongi, Monitoring and Evaluation Officer from Cbido, expressed his appreciation to the leaders of Ngara District, councillors, and community members for their strong participation and support of the Pamoja project. He acknowledged their commitment and the collaboration, noting that their involvement plays a key role in successive implementation and sustainability of project activities in Ngara District. Imani is a child living with his mother in Ngara District. Before the intervention of the Pamoja projects, Imani faced challenges in performing basic daily activities, such as washing his clothes and brushing his teeth. He depended fully on his mother for personal care and daily routines. His mother trying to narrate to the Cbido officers that after receiving support and guidance through the Pamoja project, Imani has made remarkable progress. He is now able to carry out his personal hygiene activities independently, including washing his clothes and brushing his teeth without assistance. This improvement has greatly enhanced his confidence, independence, and dignity, while also reducing the burden on his mother. The Pamoja project has played a significant role in empowering Imani to live in a more self-reliant and a fulfillment life. Imani's mother also encouraged the community not to hide children with disabilities, but instead to support and include them in the Cbido officers through outreach clinics collaborated with health service providers to deliver community education on epilepsy in children. The session focused on raising awareness about the causes, prevention, and the effects of this condition, as well as importance of early identification and a proper medical care. The initiative aimed to improve community knowledge, promote health-seeking behavior, and reduce complications associated with eye problem and epilepsy among the children. Either a doctor tried to explain other causes, like caused by accident, which cause either the brain damage, which cause the disease. A mother of a child with a physical disability affecting the bones shared her experience on how she learned about the Pamoja project through the information received her at her ward. After being informed, she visited the project services at the ward level where she received support. She explained that through the Pamoja project, she was provided with the guidance, counseling, and the parenting support on how to properly care for and raise her child with special needs. The support has helped her better understand her child's condition and improve the quality of care she provides at home. The mother expressed gratitude for the project, noting that it has strengthened her confidence and ability to support her child's development and well-being. An LGA officer from Image explained how the Pamoja project through outreach clinics conducted today, helping to address and reduce the negative beliefs and the misconception about epilepsy within the community. He noted that many of these misconceptions have contributed to stigma and discrimination against affected children and their families. Also, she emphasized that continuous community education provided through the Pamoja project is playing a key role in collecting these false beliefs. Increasing the village chairperson argued the community members to be open and honest with health and the social services profession so that they can receive appropriate support and assistance, as encouraged them. Early service will help them